you. Go ahead, Zahra.
All right. Hi, everyone. My name is Zahraa Majed, and I'm a third-year PhD candidate at Queen's University. And today I will be presenting my study, How Can Physical Activity Improve Immigrant Health and Integration in Canada? The current physical activity and integration policies in Canada are the following. First, we have the Physical Activity and Sports Act, which is an act to promote physical activity among the Canadian population, but there is no mention of immigrant population in it. Let's get moving. It's a national policy document initiative that is intended to move the country, and there is no further details regarding its implementation. And Canada's Multiculturalism Act, it's an act to promote the recognition, retention, and fostering of identities to facilitate integration. And there is no specific physical activity policy among immigrants. So why do we need these policies? Well, we need these policies because Canada is built on immigrants. It's a country built on immigrants. 75% of the Canadian population growth comes from immigrants, and it's estimated that by 2036, immigrants will represent about 30% of the Canadian population. Immigrants contribute to the social and economic development of the country, and immigrants in Canada undergo what we call the healthy immigrant effect, which is a phenomenon. Basically, it states that as immigrants live in the country, they first display good health, and then as they acculturate and live in the country, their health deteriorates with time. The factors that affect this deterioration of health can be explained by lifestyle changes such as foregoing of physical activity behavior and the consequences of acculturation. Physical activity behavior, it's a healthy preventative strategy, and it's associated with physical health benefits, mental health benefits, and an overall sense of belonging to community, positive self-identity, and social support. The current physical activity guidelines state that adults aged 18 and older should accumulate a minimum of 150 minutes of moderate to vigorous physical activity, MVPA, per week. And currently, recent immigrants are disproportionately affected by lower physical activity levels when compared to established immigrants and non-immigrants. This data is over 10 years old, and the trends of immigration have changed since then. As such, the study importance comes first. We have lack of policies. Second, physical activity is a public health issue. Immigration and physical activity are both determinants of health. There is a need to understand the relationship between acculturation and immigrants' physical activity levels. And finally, there is a need to find this physical activity data among immigrants to inform the policy interventions. My research aim of this study is to explore the relationship between physical activity, integration, and health outcomes among immigrants, and to obtain recent up-to-date immigrant-specific physical activity data to inform policy directed at improving physical activity participation and ultimately immigrants' physical and mental health. And to answer this research aim, we're going to ask 3 research questions throughout this study. So the data source access to investigate the aim and specific research questions, it's a secondary data analysis of the Canadian Community Health Survey, which is an annual population-based cross-sectional survey conducted by StatScan to collect health-related information measures for the Canadian population. And to obtain accurate estimates, data were pulled from 2016 through 2019, and participants were aged 18 and older. For the first research question, what is the prevalence of meeting physical activity guidelines and reported health status among immigrant and recent and established immigrants in Canada versus non-immigrants? For this particular research question, the measure was the prevalence of the MVPA, moderate to vigorous physical activity, meeting versus not meeting the physical activity guidelines, and the perceived health, which is good, excellent health versus poor and fair. And the years since immigration, it was stratified between recent immigrants, those who have been in Canada for 10 and less years, established immigrants, those who have been in Canada for more than 10 years, and non-immigrants. I conducted weighted frequency analysis and obtained chi-square estimates. The first results showed that 48% of recent immigrants did not meet physical activity guidelines versus 50% of established immigrants and 41% of non-immigrants. Differences between immigrant groups and meeting physical activity guidelines were statistically significant at a p-value of 0.05. Second, looking at the poor or perceived health outcomes by immigrant status, we can see that established immigrants reported highest poor or fair perceived health status when compared to recent immigrants and non-immigrants, suggesting possibly the healthy immigrant effect. So my policy recommendation from this first research question is that physical activity interventions aimed at increasing MVPA, the moderate to vigorous physical activity among immigrants, should consider acculturation, which is the years since immigration in Canada, and focus on improving established immigrants' health. For the second research questions, what are the correlates of meeting physical activity guidelines and performing leisure and non-leisure physical activity types by recent and established immigrants? So we're just focusing on these two categories. We're not focusing on non-immigrants. The measure is the correlates and the variables: age, biological sex, ethnicity, perceived health, which I explained earlier. And we have mainly leisure physical activity, which is sports and fitness, non-leisure physical activity, which is either active transportation or other physical activity, which can be either work or house chores or volunteering. And we conducted cross-tabulations and obtained chi-square estimates as well. For the, in general, the types of physical activity, which I explained, they're like active transportation, leisure physical activity, and other physical activity, we can see that this recent, that active transportation was highest among recent immigrants, and occupational and leisure physical activity was highest among non-immigrants. Then, looking between recent immigrants and established immigrants only, if we move to the types of physical activity, first, the age results, we can see that younger recent immigrants reported higher physical activity levels in all three types than older recent immigrants, suggesting that age and time since immigration may influence physical activity levels. All differences between age categories were also statistically significant. Then moving to the second variable, which is sex, looking at these three types of physical activity, we can see that males between recent and established immigrants, they showed the highest leisure physical activity among all three categories, as opposed to non-leisure physical activity, suggesting also that sex may influence physical activity participation among all three categories of physical activity. And finally, looking at ethnicity distributions, we can see that first, for active transportation, recent immigrants from almost all ethnicities except for white and East and Southeast Asia, they showed higher active transportation percentages than established immigrants. For the second outcome of leisure physical activity, there were no particular trends. However, the white established immigrants, they showed the highest percentage of leisure physical activity. And finally, the occupational, house chores, and other physical activity category, there were no actually particular trends there to mention. So my policy recommendation for the second research question is that strategies to increase physical activity among immigrants should consider time in Canada, age, sex, ethnicity, and types of physical activity when coming up with recommendations and with policies. And now moving for the final research question, what is the relationship between having good perceived health, good mental health, meeting physical activity guidelines, and different predictor variables? So to answer this question, I conducted 3 different weighted multivariate logistic models and obtained odds ratios and applied bootstrap weights provided by StatScan. And here for the 3 models, we have the first model, it's the MVPA, that's the outcome, meeting physical activity guidelines versus not meeting physical activity guidelines. The second model is the perceived health. And then the third model is the perceived mental health. And these are stratified by poor, fair, and good and excellent. So it's a binary outcome. Poor, fair is one category, and good and excellent is the second category. And all of these models were had the same control variables, which are age, sex, ethnicity, income, marital status, and educational levels. For the independent variables, I just highlighted here the variables that I will be explaining later on. And these are belonging to local communities. So here we're looking at weak versus strong belonging to local community. Integration scale, so it's from low integration to higher integration, and stress levels, which is not stress to like stress the most. For the first model, MVPA, adjusting for all variables in the model, those who reported higher belonging to the community and better perceived health reported better, reported meeting the physical activity guidelines, suggesting that belonging and health are related with moderate to vigorous physical activity guidelines and meeting the guidelines provided by the government. For the second model, perceived health, adjusting for different variables in the model, those who meet the physical activity guidelines, those who report better integration, more belonging, less stress, reported better perceived health outcomes. And similarly, the third model, perceived mental health, we have similar trends to the previous one. Those who reported higher integration, higher MVPA, and more belonging, less stress, reported better perceived mental health outcomes. So what do we get from all of these results, specific for the third research question? So my third policy recommendation is that we should improve the integration policies. I know it's very vague, but perhaps including a health component and a health consideration in these integration policies could be really helpful, since we have a positive relationship between integration, health, and MVPA, which is physical activity participation in general. My fourth policy recommendation is to implement and evaluate the Let's Get Moving initiative, which I mentioned earlier in my presentation, and ensuring proper immigrant representation in it that takes into account different variables such as age, sex, ethnicity, and other predictors. My fifth and final policy recommendation is to engage community organizations with the implementation of physical activity promotion interventions to ensure that they're actually being implemented. And the research implications of my 5 policies.
Zahraa, I'm sorry, but we need to cut you off here.
Oh, I'm sorry. It's the last slide.
Okay. If you wrap up very quick.
Sure. So my research implication is to understand the barriers to low physical activity levels among immigrants and the relationship between acculturation and its acculturation effect on established immigrants. Thank you so much. And this concludes my presentation. I'm sorry, I'm over the time limit.
Okay, let's start with Ramona this time with the judges' questions.
Thank you for that. I'm really curious about this relationship between integration and health. You sort of said if you increase integration, you can improve health. Can you tell me if there's a directional, if it could go the other way around? If you improve health, you increase integration? Is it?
Actually, yeah. So I did apply the analysis on this model, but I haven't reported that because it wasn't related to my research question. But yeah, if you improve your health outcome, if you have better perceived health outcome, you tend to have in general better integration in the community. Although, like, again, my research did not really ask this question, so I can't really speak further on that.
Okay, thank you.
Jeremy.
Thank you, Zahraa. It's a nice presentation. Would you, given that you laid the foundation of existing policies and that there is nothing specific for immigrants, would you suggest a new start from scratch policy for immigrants, or would you work within some of the ones that already exist to emphasize the issues that you have demonstrated today?
Definitely, I would go with the second part, which is go with already established policies, and then from these policies include a component that would be related to immigrants specifically, and this could further be specific, related on different predictors, related on working with local community organizations that are more familiar with what the community actually needs. Because I feel like if you want to go ahead and create a policy from scratch, some of it will be redundant because like there are similarities between the Canadian population and the immigrant population. So it makes more sense to go with the second approach.
Okay, Marian.
I really have more of a comment than a question, and that is that I think that the charts at the beginning would be much more useful if they were not univariate, but instead, for instance, showed some of the differences for the people who are age 30 to 50, for instance. I'll just leave it there.
Okay, thanks.
So maybe you could comment
Just
presenter about that kind of consideration, whether you considered that way of presenting the data.
So are you just to make sure I got what you're saying? So are you suggesting to look further within this particular age group or within all age groups?
With one age group, just choose one age group, or you could choose two different age groups for two sets of charts, but to reduce the number of, to increase the amount of information that the reader gets or the viewer gets for a given dependent variable that you were interested in.
Yeah, I think this could be something I could look into. I haven't looked into different specific age groups, to be honest, among adults. I was just looking at different trends and how these variables would look in different age groups. And as you saw in my results, younger respondents showed better physical activity participation in most of the categories. So perhaps maybe taking your comment into consideration, I could further look into that and see if there's something significant there.
Okay, thanks.
Okay, Hugh.
Yes, I'll keep it short again. I was wondering, did you examine the income component to physical activity and leisure time a bit more thoroughly? I don't know if you did in your research, but you have to have a higher level of income usually to participate in a lot of these leisure activities. And I was just wondering if you had a chance to look at that in a bit deeper.
Yeah. So I did look into that on a bivariate level without looking without the multivariate component, just because it was some of the income categories were significant with the physical activity component. On a multivariate level, they were not significant anymore. So I mean, it makes sense that more the higher income you have, the more physical activity you're gonna be doing, because you can afford going to recreational facilities,
more time
all
too,
of that,
right?
and you have more time, exactly.
Yes.
And if you have children, you can afford childcare. All of these variables taken into consideration, but they were not significant in my results.
Thank you. That was very good. Thank you.
Okay, and last but not least, Mark.
Yeah, nice presentation, Zahraa. This is more of a comment just along the lines of Marian. And it's a methodological comment, and that's basically what I'm here for, not the policy side of things. So, and it reflects my bias against odds ratios. And I would just encourage, everyone, all of the presenters, if you ever come across odds ratios, I am not a big fan of them. They're very difficult to interpret, especially from a policy perspective, when you're trying to get an idea of the size effect of a coefficient, right? The logistic coefficients obviously are no better. You want to convert them to something, but modern methods allow you to convert it to a marginal probability effect. So what's the difference in the percentage point, for example, in some metric that you're looking at, rather than odds ratio. So it's more of a comment, but good presentation overall. Thank you.
Thank you. I take that into consideration for sure.
Okay, so judges, you have a minute before we can move on to our next presentation.